Claire Armstrong.
Thanks, Professor. Just regarding the vaccine, I know the government has, and yourself has said you won't be rushing approving that, but given the consistent breaches from hotel quarantine we're seeing, can you explain exactly what is taking time? Are we waiting on certain data? What is the process there that means that you're suggesting we won't have the vaccine until about March? And will the TGA be working through the Christmas period, or do they have a shutdown? What's the time frame likely for their consideration of the vaccine?
So in terms of the vaccine, we are continuing with all of our planning as has been already outlined in our strategy for the vaccines, including the prioritisation process, including specific arrangements and agreements with every state and territory. We're in the second round of negotiations on that because the states and territories, of course, are very key partners in relation to the implementation of any vaccination strategy. So they will be, they are progressing. The plan is to have them completed in early January, those implementation plans. We have a specific meeting tomorrow with the Chief Health Officers and the Secretaries or Directors General, CEs and so forth of all of the health departments around Australia. We'll be talking through those practical matters about the implementation of the vaccine strategy. So there are various components to this work. We firstly have to purchase the vaccines and make sure that they are coming to Australia or indeed being manufactured in Australia, as we have with our CSL partners in Melbourne. So that part of that is being completed. We continue to have discussions with the pharmaceutical companies in relation to those matters. We then have to move on to the regulation pathway, and just to be clear, there is no vaccine anywhere in the world, in any country in the world, that has received its final approval for open distribution to the population. There are several countries in the world that have emergency use authorisation because they have emergencies. I talked about the US earlier, 200,000 cases yesterday. They have an emergency. They need to get on with it. Same in the UK, same in Europe overnight. We are not going down that pathway because we don't have anywhere near that need right now. But we're certainly not stopping in our preparations. So that will proceed. The regulators will look at all the information. Just to answer your specific question there, Claire, no, they're not resting over Christmas. They're continuing, and they will, as the information comes from the various companies, particularly Pfizer and particularly AstraZeneca, because there are two main first vaccines off that will be looking to be approved and rolled out early next year. As we get any information from that, it's processed. There are tens of thousands of documents and so forth that will need to be processed as part of the usual approval. I'll go to Chloe.